Your skin, your fingernails, even your breath can tell a more honest story about your kidneys than the most careful conversation in a doctor's office. Around 9 out of every 10 people who have chronic kidney disease have no idea they have it. That is not a rare condition I am describing. It is far more common than most people imagine. The kidneys are just remarkably quiet about their own decline. They give almost no warning until they have already lost a huge chunk of their function. And by the time something shows up on a routine blood test, the damage has often been building quietly for years. In the next few minutes, I want to walk you through 17 signs that can point to kidney trouble long before any lab result catches it. Spot this early and your kidneys can stay with you for decades. That is not a hopeful theory. It is what happens every single day in nephrology practices around the world. If you want health information explained clearly and honestly, hit subscribe and leave a like. That is genuinely how this channel keeps growing. The goal is 300,000 subscribers, and you are part of getting there. For practical checklists and short health posts you can save on your phone, scan the QR code on screen. That is my Telegram, and that is where the extras live. Before we get to the signs, a quick picture of what your kidneys actually do, because most people get this wrong. The kidneys are 2 bean-shaped organs sitting in your lower back just under your ribs, one on each side of the spine. Most people think of them as filters. Blood goes in, urine goes out, garbage gets dumped. That is true, but it is a small slice of the picture. Your kidneys also regulate sodium, potassium, and the other electrolytes that keep your nerves firing and your heart beating in rhythm. They control the acid-base balance of your blood. They produce a hormone that tells your bone marrow to make red blood cells. They directly affect the strength of your bones. And they help control your blood pressure through a sophisticated chain of chemical signals. The kidney is not a passive filter. It is a central regulator. When it starts to slip, the consequences show up just about everywhere. On your skin, in your heart, in your blood, in your brain, in your bones. That is why the signs of kidney disease are so scattered. You will see exactly what I mean as we go through them. Let's start with something a lot of people notice and almost everyone shrugs off: foamy urine. I am not talking about a few bubbles that vanish in a couple of seconds. That happens to everybody and depends on angle, pressure, and a dozen ordinary things. I am talking about real, thick, white foam that sits on top of the water and stays there. Picture the head on a glass of beer. That kind of foam is what happens when a blood protein called albumin starts leaking into your urine. Albumin has a structure similar to soap, which is exactly why it makes that stubborn, dense foam. In a healthy kidney, albumin never gets through. To understand how it ends up there, you have to look inside the kidney itself. Each of your kidneys holds around 1 million microscopic filters called glomeruli, clusters of tiny blood vessels so narrow that red blood cells have to squeeze through almost single file. Wrapped around those vessels are specialized cells called podocytes. Podocytes have tentacle-like extensions that interlock with each other to form a living mesh. Small molecules pass through. Larger ones, like proteins and blood cells, stay behind. It is a strikingly precise piece of biology. When podocytes get damaged, those extensions flatten out, gaps open up between them, and albumin starts slipping through. For a long stretch, you feel absolutely nothing. The only visible clue is that thick foam in the toilet bowl. If you have been noticing it consistently, that is worth bringing up with your doctor. A simple urine test can check for albumin. It costs very little, and in clinical practice, it is often the first hint that something is starting to go wrong. The next sign is directly tied to that protein leak: swelling. You can actually run a quick test on yourself right now. Roll up a pant leg and press your thumb firmly into your shin, the front of the bone, just below the knee. Hold for about 5 seconds, then let go and look at the skin. If your thumb left a clear indentation that does not smooth back out right away, that is what doctors call pitting edema. The dent stays because the tissue is waterlogged. Here is why it happens. Albumin in your blood pulls fluid into your blood vessels and holds it there. If that sounds technical, just picture albumin as a magnet for water inside your veins. When albumin starts leaking out into your urine, its level in your blood drops and the pull weakens. Fluid starts seeping out of the vessels into the surrounding tissue. Gravity drags it downward, so the swelling usually shows up in your ankles, feet, and lower legs. It can also collect in the loose tissue around your eyes, which is why some people wake up with puffy faces and swollen eyelids and just assume they slept badly. The situation then feeds itself. Less fluid inside the vessels feels to your kidneys like dehydration, so they do exactly what they were built to do under that signal. They hold on to more salt and water. That extra fluid leaks straight back into the tissue. The swelling worsens instead of resolving. In serious cases, fluid even collects inside the lungs and breathing becomes hard work. To be clear, swollen ankles after a long day on your feet are normal and they should be mostly gone by morning. The version to take seriously is the one that does not resolve overnight, that gets worse over days, or that shows up around your eyes when you wake. That is the kind that earns a kidney check and a heart check both. Here is a myth I hear all the time. If somebody goes to the bathroom frequently and produces plenty of urine, the assumption is that the kidneys must be in great shape. That is not how it works. With kidneys, what matters is not the amount of urine, but its concentration. And one of the very first things that fails in early kidney disease is the ability to concentrate urine, especially at night. In a healthy person, the kidneys produce a small amount of very concentrated urine while you sleep. That is thanks to a hormone called antidiuretic hormone, often shortened to ADH. ADH tells the kidneys to hold on to water overnight. When the kidneys stop listening to that signal as well as they used to, the urine becomes diluted, the volume goes up, and you start getting woken up. One trip to the bathroom at night, maybe 2 for older adults, is in the normal range. Getting up 3, 4, 5 times in a night without having chugged water before bed is a real signal. The medical name for it is Nocturia, and it can be one of the earliest visible markers of declining kidney function. Now let's look at fingernails. This is one of the most underrated sources of information on your whole body. In most people, the nail on the thumb shows 2 clear shades. There is a pale half moon at the base of the nail called the lunula, which is the part of the nail that is still forming. The rest of the nail is a healthy pinkish color. In people with long-standing chronic kidney disease, nails can also look two-toned, but the picture is different. The lower half of the nail is dull and white. The upper half has a distinct reddish-brown color. The medical name for this is half and half nails, sometimes called Lindsay's nails after the doctor who first described them decades ago. Not every kidney patient develops them, and the exact mechanism is still being studied, but the connection with chronic kidney disease is well documented in the dermatology and nephrology literature. If you look down and see this pattern on yourself or someone close to you, that is a reason to ask for kidney labs. Now to a mineral that behaves in a particularly nasty way when kidneys are failing: phosphorus. You get phosphorus from food, and the modern diet is loaded with it. It is in meat, in cheese, in soft drinks, in fast food, in ready-made meals, in processed snacks. Healthy kidneys have no trouble dumping the excess. When the kidneys are damaged, that ability fades and the phosphorus level in the blood starts to creep up. This is a real problem because phosphorus binds tightly to calcium. The two have a very strong chemical attraction to each other. They link up and form crystals of calcium phosphate. And those crystals start depositing themselves in places where they really should not be. When they end up in the skin, the condition is called calciphylactic skin calcification, or cutaneous calcinosis. It looks like firm, pale, yellow-white lumps just under the skin. Painless, hard like pebbles. Sometimes they break through the surface and release a chalky white paste, often compared to toothpaste in consistency. Skin calcification can happen with other diseases too, such as scleroderma and dermatomyositis, but it absolutely happens in advanced kidney failure. And that, strangely enough, is not the worst case scenario. The same calcium phosphate crystals can also deposit inside the walls of your blood vessels. When that happens in the small skin vessels, you get a far more dangerous problem called calciphylaxis. The vessels effectively clog from the inside, the surrounding tissue stops getting oxygen, and the skin starts to die. This is a life-threatening condition that needs urgent hospital care. Cases of calciphylaxis show up in nephrology practice, especially in people on long-term dialysis. It is rare, but it is real, and it is one of the reasons phosphorus levels matter so much in kidney patients. There is also a quieter version of vessel damage from the same mineral imbalance. Picture an X-ray of a normal arm. You would expect to see bones clearly, but you should not see the outlines of arteries. Healthy arteries are essentially invisible on a plain X-ray. In people with long-standing kidney disease, the arteries often show up clearly, almost as if someone traced them in with a pencil. What is going on there? A healthy artery wall is made of elastic, smooth muscle cells that can contract and relax, regulating blood flow and pressure. But when those cells sit for years in an environment with high phosphorus, they start to undergo a kind of identity crisis. They begin behaving like bone cells. They start laying down calcium and phosphorus inside the artery wall, almost as if they were building bone where it has no business being. The artery wall stiffens. The elasticity disappears. The artery becomes a rigid tube. You can sometimes feel this through the skin, on the wrist or the lower leg, where surface arteries can feel taut and ropey, almost like guitar strings stretched under the surface. This stiffening is a major contributor to heart attacks, strokes, and heart failure in people with chronic kidney disease. To try to keep phosphorus under control, the body activates its own hormonal damage control. The main player here is a hormone with the slightly intimidating name of fibroblast growth factor 23, or FGF23 for short. It tells the kidneys to flush more phosphorus out in the urine, and it tells the gut to absorb less phosphorus and calcium from food. It pulls off the second part of that job by blocking the conversion of vitamin D into its active form. For a while, this strategy works and the phosphorus level stays manageable, but the cost is a drop in calcium. And right around then, another symptom often shows up. Painful muscle cramps, especially at night. The classic version is a hard, knotted cramp in the calf, hitting just as you start to drift off to sleep. This is very common in the early stages of kidney disease, though low calcium is not the only cause. Low magnesium does the same thing, increased acidity of the blood does the same thing. Often it is some combination of these. If you have been having persistent nighttime cramps and you have not started any intense new training or restrictive diet, that is a reasonable moment to ask your doctor about checking your kidney function and your electrolyte levels. It is a basic blood test and it clears up a lot of mysteries. The low calcium then triggers the next domino. The parathyroid glands, 4 small structures in your neck, sense the drop and release parathyroid hormone. Parathyroid hormone has one job in this context: pull calcium out of your bones to top up the level in your blood. In the short term, it works. In the long term, it is a disaster. Your bones get thinner, less mineralized, and increasingly fragile. Osteoporosis sets in. The clearest red flag specialists look for is loss of height. When someone says they used to be 5'10" and they measure 5'6" now, that is a real warning. Most of the time, the explanation is compression fractures in the vertebrae of the spine. The bones literally collapse a little under everyday weight. The spine shortens and posture changes. The other clear marker is fragility fractures. When a person falls from standing height onto a flat floor and breaks a wrist or a hip or a vertebra, that is not an accident. That is a pathological fracture. In people with longer standing kidney disease, the rate of these fractures runs well above average. Electrolytes are only part of the problem. As kidney function drops, dozens of toxins normally cleared out in urine start to accumulate in the blood. That state is called uremia, which literally translates as urine in the blood. Uremia produces a long list of symptoms, many of which look totally unrelated to the kidneys at first. One of the earliest and most miserable is itching. Not local itching the way you would get with a bug bite, but generalized itching all over the body and characteristically worse at night. There is a well-documented pattern in primary care that goes something like this. A man in his late 50s, let's call him James, comes in complaining of relentless full-body itching. He has been scratching himself raw, cannot sleep, has tried every lotion in the pharmacy. Allergy testing turns up nothing, the dermatologist finds no rash, and the symptom just keeps escalating. Eventually, somebody runs basic kidney labs and finds significant chronic kidney disease, well advanced. The itching turned out to be the main visible sign. The mechanism is complex. Uremic toxins settle in the skin and irritate nerve endings there. They activate specific receptors involved in itch, particularly one called PAR2. Once those nerve endings are sensitized, even small inputs like a light touch, a change in temperature, or contact with clothing register as itch. Over time, the toxins also affect the brain directly and start to overactivate central itch pathways. At that point, the person is not really itching because of skin. The brain itself has become convinced that itching is necessary. It is one of the hardest forms of itch to treat. Another nighttime symptom often shows up around the same time: restless leg syndrome. This is the irresistible urge to move your legs that hits when you lie down, especially at bedtime. You cannot keep your legs still. You stretch them, you flex them, eventually you get up and walk around just to make it stop. Sleep gets wrecked. The leading theory connects restless leg syndrome to iron metabolism in the brain. When the brain runs short on iron, dopamine production suffers, and dopamine is needed for the motor pathways to behave properly. What does that have to do with kidneys? When uremic toxins build up, the body enters a state of chronic low-grade inflammation. With chronic inflammation, the body produces more of a hormone called hepcidin. Hepcidin is normally a useful defense. When an infection hits, bacteria try to steal iron to grow, and hepcidin hides iron away in storage and blocks new iron absorption from your food. That gives your immune system time to clear the infection. It works beautifully for short, acute illness. In chronic kidney disease, inflammation never resolves. Hepcidin stays high. Iron stays locked away. The brain runs chronically short of it, and restless leg syndrome shows up. If you struggle to fall asleep because your legs will not settle, that is worth asking about. Both a kidney panel and a check of iron stores, particularly a ferritin level, can clarify a lot. When toxins build up, taste and appetite take a hit as well. A common complaint is a persistent metallic taste in the mouth, almost like licking a coin. Where does that come from? Some of the urea in your blood ends up in your saliva. Your mouth is home to an enormous population of bacteria, and they break that urea down into ammonia and other compounds. Those compounds stimulate certain taste receptors on the tongue, and your brain reads that as a metallic flavor. Unfortunately, the same compounds also produce a characteristic unpleasant breath odor, sometimes described as smelling slightly like urine or ammonia. In medical writing, that breath is called uremic fetor. It is a recognized sign that immediately raises kidney concerns for anyone trained to spot it. When your favorite food suddenly tastes like metal and your breath has that ammonia edge to it, it is not surprising that appetite collapses. And it gets a little deeper than that. Uremic toxins act directly on the brain. In the brainstem, there is a region called the chemoreceptor trigger zone. Its job is to monitor the blood for poisons. What makes it special is that it sits outside the protection of the blood-brain barrier. The blood-brain barrier normally keeps unwanted molecules out of the brain. It is your brain's gatekeeper. The chemoreceptor trigger zone deliberately bypasses that gate so the body can detect toxins fast and respond. When this region picks up a poison, it issues two instructions: stop eating, and if necessary, throw up. It is an ancient survival mechanism that protects you from food poisoning. In kidney failure, the very same zone gets triggered by uremic toxins. The brain concludes you have been poisoned. Nausea sets in, appetite disappears, vomiting can follow. On top of all that, weight comes off. No diet, no exercise plan, just the slow loss of being able to eat. If you or someone close to you has been losing weight without trying, feels nauseous a lot, has lost interest in meat in particular, and is getting weaker, that is firmly a reason to check kidney function. Here's another sign that often gets dismissed: easy bruising. The normal kind of bump that everybody gets, like clipping a coffee table with your knee or catching a door frame with your shoulder, suddenly turns into a big purple bruise the next day. Sometimes bruises show up with no memory of an injury at all. Why does that happen? Normally, when a small vessel is damaged, tiny blood cells called platelets rush in. They stick to each other, form a plug, and seal the leak. They are your built-in patch. In kidney disease, uremic toxins make platelets less sticky. They do not clump together as well. Bleeding takes longer to stop. Bruises get bigger, gums bleed when you brush your teeth, nosebleeds get more frequent and harder to stop. If you have been noticing a pattern like that, it is another reason to run kidney labs and see how things look. There is a rarer sign that I want to mention because it shows up in textbooks even though most people will thankfully never see it. In clinical observations, there are cases where patients on dialysis missed several sessions in a row. The level of toxins in their blood climbed to dangerous heights, and a fine white powder appeared on their skin, as if someone had dusted them with flour. That coating is called uremic frost. It forms when sweat becomes so saturated with urea and other waste products that, as the water evaporates, the dissolved toxins crystallize directly on the surface of the skin. Modern dialysis is good enough that uremic frost is almost extinct in well-managed patients. But if you ever see it, it is the sign of severe, very advanced kidney failure that needs immediate care. A more dangerous late-stage problem from uremia is inflammation of the sac around the heart. Your heart sits inside a thin membrane called the pericardium. When uremic toxins irritate it, you get uremic pericarditis. And unlike a swollen knee, you cannot rest a heart. It keeps beating, constantly moving against the inflamed sac. The result is sharp, stabbing chest pain, usually worse with deep breaths and when changing position. With a stethoscope, a doctor can sometimes hear a characteristic scratching, rubbing sound, almost like leather creaking. That is the inflamed pericardium grinding against the beating heart. Uremic pericarditis is a medical emergency, often requiring urgent dialysis. If chest pain like that ever shows up, especially in someone with known kidney issues, that is an emergency room conversation, not a wait and see one. And now back to the symptom that comes up more often than any other: fatigue. Not, I had a busy week tired, but heavy, grinding, won't go away after sleep exhaustion. A lot of what we have already covered contributes to it. Lousy sleep from cramps, itching, and restless legs, electrolyte chaos, toxin buildup, but there is a specific cause that is treatable and it is worth understanding. Your kidneys produce a hormone called erythropoietin, usually shortened to EPO. EPO tells your bone marrow to make red blood cells, the cells that carry oxygen. You may know EPO by reputation. It became infamous decades ago as a doping agent in cycling because boosting EPO artificially lets athletes deliver more oxygen to their muscles and ride for longer at higher intensities. The flip side of that is exactly what happens in kidney disease. When EPO production drops, the bone marrow makes fewer red blood cells. Anemia sets in, meaning your hemoglobin, the oxygen-carrying molecule in red blood cells, falls below normal. Your tissues run chronically low on oxygen. You go pale, you get out of breath climbing a single flight of stairs. You feel wiped out doing almost nothing. The good news here is that this kind of anemia responds to treatment. Synthetic versions of erythropoietin exist and are given as injections, and they restore hemoglobin reliably. For kidney patients, that single piece of treatment can be the difference between barely functioning and getting through a normal day. And then there is the 17th sign, which is in many ways the most dangerous one of all. No symptoms at all. Chronic kidney disease is divided into 5 stages. Stage 1 is the mildest. Stage 5 is end-stage kidney failure, where dialysis or a kidney transplant is on the table. Most people do not notice anything wrong until at least stage 3. By that point, the kidneys have already lost a substantial part of their function. Up until then, the disease usually gets caught by accident. Somebody runs a routine blood panel for unrelated reasons and the creatinine number comes back off. That is why regular checkups and basic screening labs matter so much, especially if you have risk factors, and a lot of people do. The 2 biggest causes of kidney damage in the modern world are diabetes and high blood pressure. Both of them can either be prevented or, where already diagnosed, kept under good control. Diabetes damages the tiny vessels of the glomeruli. High blood pressure tears them up from the inside through pure mechanical force. If kidney disease, diabetes, or high blood pressure runs in your family, or you already know you have elevated blood sugar or elevated blood pressure, getting a basic kidney panel once a year is the kind of habit that pays off enormously. A serum creatinine and a urine test for albumin are inexpensive, widely available, and they tell you a great deal. A specific word about painkillers. There has been a steady rise in cases of kidney damage among people who take medications like ibuprofen or naproxen on a long-term basis. These drugs are sold over the counter, often advertised as routine, safe options for any kind of pain. So many people end up taking them daily for a headache, for back pain, for joint pain. They are part of a group called non-steroidal anti-inflammatory drugs, or NSAIDs. They are not harmless. With long-term, regular use, they damage not just the stomach lining and the heart, but the kidneys too. They reduce blood flow through the tiny kidney vessels and can cause both sudden and slow developing kidney injury. These medications are best used occasionally when you actually need them. If you are taking them regularly for any reason, it is worth talking to your doctor about checking your kidney function every 6 months or so. Kidney function is also tightly linked to age, and this is a straight medical fact. After age 40, the filtering capacity of the kidneys declines by roughly 1% per year on average. By the time many people reach 60, their kidneys are objectively working at a lower level than they were at 30. That does not mean everyone develops disease. It does mean that past a certain age, kidneys quietly start needing more attention. Tell me in the comments how old you are. I am genuinely curious how relevant this topic is for the people watching this channel, and at what age questions about kidneys really start showing up. Here is the short version of everything we covered. Your kidneys are not just filters. They are central regulators that touch almost every part of how your body runs. Kidney disease is quiet for a long time, but it leaves footprints all over the body. On your skin, in your nails, on your breath, in your bones, in your blood, in your blood vessels. If several of the signs from today sound familiar, things like foamy urine, swelling, getting up multiple times a night to urinate, half and half nails, nighttime cramps, generalized itching, restless legs, a metallic taste, easy bruising, persistent fatigue, there is real value in running a basic set of labs. The starting point is a creatinine blood test, a calculated estimated glomerular filtration rate, and a urine test that includes albumin. The results will tell your doctor whether a referral to a nephrologist makes sense. And if you already live with diabetes, with elevated blood pressure, or you take pain relievers regularly, this conversation with your doctor is worth starting now rather than waiting for symptoms. This is educational content. Use it to ask better questions at your next appointment, not to replace that appointment, because nobody knows your full picture the way your own physician can. If this was useful, hit subscribe and leave a like. That is honestly what helps this channel keep growing. The goal is 300,000 subscribers, and every new one of you brings it closer. For checklists and short health posts that are easy to keep on your phone, scan the QR code on screen right now. That is where my Telegram lives, and that is where the practical stuff goes out.